Hi, I'm Dr. Chris Williams. I'm a pediatrician in Minneapolis, practicing in the inner city. And I'll tell you my view on the health care legislation now. There's all this talk about government health care, and I have to tell you my experience with government-run health care has been very good. I see a lot of children on the Minnesota Care program, which is funded in part through federal money. That program has been very successful here in Minnesota and around the country. It allows me to see a lot of children that I wouldn't normally see. A lot of these are children who aren't the poor kids. These are the kids from a lot of working families where the parents make too much money to qualify for Medicaid, but not enough money to really afford the private insurance offered through their jobs. And so a lot of these kids were just left out there. A lot of them had illnesses, asthma, other illnesses. And basically they were just going without and just hoping their health care plan was, let's just hope you don't get sick. And we all know that doesn't work. By being able to see these kids, I can do a lot of preventive care, make sure they're growing up healthy, treat the chronic illnesses such as asthma, keep them out of the emergency room. And in turn, that keeps their parents from having to take off work to spend time with kids who get hospitalized, having to get up in the middle of the night, take them to the hospital, and then have to call in to work the next morning. So it's sort of a win situation for everybody. And again, it's a government-run program. It pays, reimburses well. Not a lot of hassles with it. The coverage is good. Medications are covered. This is overall a good program. The insurances that I have the most issues with are, in fact, the private insurers. And I can, they're the ones where they tell you, well, you can't prescribe this drug, this medication, where I spend a long time on the phone waiting to get approval for tests and things that, I know this should be done. All the literature says should be done, but the insurance company wants us to jump through hoops. And so that's sort of my with the private insurance. I'd rather have the government insurance. And I had another experience with insurance companies when I tried to open my own practice in Michigan. I was with an inner city hospital in Detroit that had trouble keeping their doors open. They ended up seeing a lot of patients who were uninsured, couldn't afford their bills, but were short for care anyway. So that hospital closed, and I was working with that hospital. They sort of let us all go. And I tried to establish my own practice. And my biggest obstacle was working with the private insurance companies, getting credentialed, getting paid for them on time. One particular insurance company actually sent me a bill for seeing their patients. Another time I had to get on my bicycle and ride from suburban Detroit to downtown Detroit to get my money because the insurance company wouldn't send it. I called them on the phone and said, I'm going to be down there in exactly 45 minutes. You better have my money. And it was about 90 degrees. I got on my bike, rode down to Detroit, and exactly 45 minutes later I was there at the door. And I came in, it was about 90 degrees out looking crazy, and somehow they found my money then. Never had to do that with the government. Never had a couple quick phone calls, things were taken care of. I would say let's get the government insurance. If it's administered well, it can work, especially with the children. It works really well. And I think that would be the good basis for any kind of benefit system.
And do you feel the public option is the smart way to go about reforming healthcare?
Definitely. If it's well managed, that's a good start. And then you work on how to manage it, the administration of it, negotiating the rates with the physicians and hospitals. And that can actually, if it's done well, that can actually be a very good program.